Good day, fellow learners. It's been a while, and I'm joining you now from the second floor of the Ray A. Gapuz building here at the United Nations Avenue in Manila, Philippines. And today, we're going to talk about one of the most commonly asked concepts in terms of the trends when you talk about next generation NCLEX. But before we talk about it, let me ask you to join us in this mission. Our goal is to provide free NCLEX RN application and review to 500 nurses, and to help us achieve this, just watch and finish the ads in our videos. And if you share this video to at least 10 of your friends, we'll pray for your success. Thank you for doing so. Those of you who are missing out on the videos that I created for the nurse licensure exam, you can actually find it in the live stream section of our YouTube channel. Okay, before we start, let me congratulate Mr. Arnel Manyalak of Central Escolar University for passing the New York Board of Nursing last April 28, 2025. That's just a couple of days ago. And here is his success recipe. To God be all the glory. Thank you, Lord. After 30 years of deep sleep in the nursing field, I decided to take the NCLEX last April 28. With the help of the good Lord, the computer stopped at 85th. It never came to my mind that I will pass, since I had only attended 10 days of face-to-face QUICKFIX bootcamp. That's what he attended in Baguio City, our bootcamp site, and a 3-day QUICKFIX with only a week remaining before the exam. I want to thank Dr. Ray Gapuz for the amazing type of review he had shared to us. The way he explained and elaborated each topics together with every R test had enlightened me and inculcate in my mind all those topics. Doc Ray, such a good mentor. Ibang klase ika nga. All you must do is to listen carefully to him and don't get annoyed with all the paper and computer-based tests. I'll assure you this will boost your self-confidence and face the NCLEX calmly with a ton of knowledge acquired from Doc Ray. Thank you very much for the kind words, Arnel. And most especially, add a lot of prayers every day, because with God, all things are possible. Again, thank you, Doc Ray, and to all the staff of our AGRS. Hindi ko matatamo ang tagumpay na ito kung hindi ako nakapag-review at nagtiwala sa system niyo. God bless you all and more power. Arnel Manyala, USRN. Well, his last advice was he wouldn't be able to achieve all of this if he did not review with us and if he did not trust our system. Thank you very much for the trust. And now, on to case number 41. And this time around, we're going to talk about pyelonephritis. As the term implies, this is actually a condition that affects one or both kidneys, okay? So it is a bacterial infection. The most common causative agent is your Escherichia coli, which could potentially be found in fecal matter. That's why pyelonephritis is usually common among females, because when they wash or clean themselves, sometimes they clean themselves using tissue papers from back to front, and that could potentially introduce your E. coli from the fecal matter into the perineal area and into the vaginal orifice. So that could potentially lead to pyelonephritis. So the way to do it is to wipe oneself from front to back, never from back to front, okay? So the bacterial infection causes inflammation of the kidneys, often resulting from untreated urinary tract infection that spread upward. So this could sometimes begin as cystitis, and then eventually the infection ascends. So pyelonephritis is a type of ascending infection that eventually affects the kidneys. Okay, so let's move on. What are the common risk factors? Remember, PINGDOC, okay? Pregnancy, and this is due to the change in the hormones that could potentially affect the protective coating of the vaginal mucosa, making it more at risk to bacterial invasion. And then immunosuppression, neurogenic bladder, which simply means in neurogenic bladder, the bladder does not empty fully. So there's going to be frequency, and that eventually introduces bacteria into the urinary tract. And of course, females, because they have shorter urinary tract and because of their tendency sometimes to employ the wrong technique when they're cleaning themselves. Diabetes mellitus, urinary obstruction, prolonged use of catheter. Remember, your catheter can potentially damage the mucosal lining of the genitourinary tract. Potentially, also, it can introduce bacteria into the system. And known conditions like vesiculo-ureteral reflux, in which there's a backflow of urine, and then frequent urinary tract infection. Remember, pink dot. Now, cotton underpants can help prevent pyelonephritis. However, there is an old belief that has already become archaic, meaning an obsolete concept, that silk underpants or underwear could actually increase the risk. Now, there are studies that have disproven that misconception. Although silk underwear does not have direct relationship with the development of pyelonephritis, it is best that clients who may want to prevent pyelonephritis should wear cotton underpants instead. Okay, now, since pyelonephritis is an inflammatory condition, there would always be pain. However, the pain in pyelonephritis could sometimes be mistaken with the pain of preterm labor, the pain of renal colic, and the pain of cystitis. So let's differentiate one from the other. In pyelonephritis, the pain is at the flank or lower back. It is dull and constant. Remember, dull, constant flank pain. In renal colic, the pain is also at the flank, but it radiates to the groin, okay, the inner thigh. And this time around, in renal colic, the pain is sharp and severe and crampy. The patient would usually be feeling so sick, and usually the pain in renal colic is not relieved by analgesics. Okay, next, in preterm labor, the pain is also found at the lower abdomen, just like your cystitis. However, the pain in preterm labor radiates to the back and it is crampy or dull. Now, comparing that to the pain in cystitis, the pain is also at the lower abdomen, but the pain is burning or stinging. Now, let's identify. Pyelonephritis and renal colic both affects the kidneys. So, the pain would be at the lower back or the flank. The difference is, if the pain is at the flank but dull and constant, think pyelonephritis. If the pain is at the flank but it's sharp, severe, and cramping, think renal colic. Now, if the pain is cramping or dull but it's found in the lower abdomen, think preterm labor if the patient is pregnant. And if the pain is also found at the lower abdomen but it's not dull, it's rather burning or stinging, then think about cystitis. So pay particular attention to two things: the location and how the pain is described. So flank pain, think pyelonephritis or renal colic. Flank pain that's dull, pyelonephritis. Flank pain that is sharp or severe, renal colic. If the pain is found in the lower abdomen, think preterm labor or cystitis. If the lower abdominal pain is crampy or dull, that's preterm labor. The patient is pregnant. But if the lower abdominal pain is burning or stinging, think about cystitis. I hope that helps. So let's move on. Treatment of pyelonephritis include, remember the code, the acrostic HAP, hydration, increase fluids 2 to 3 liters per day. Antibiotics, the first line would be your fluoroquinolones, specifically ciprofloxacin. That's usually given 7 to 14 days, ciprofloxacin or levofloxacin. Okay? And of course, pain management, in which acetaminophen is usually preferred. Why not ibuprofen? Because ibuprofen is nephrotoxic. It has the potential to worsen the kidney condition. So remember, ibuprofen can potentially worsen kidney function in a client with pyelonephritis. That's why if a physician orders ibuprofen for the pain experienced by the client with pyelonephritis, clarify the doctor's order, because ibuprofen is nephrotoxic. Now, for those of you who are asking which book you need to read for the NGN not because I'm the author, but they recommend my new book, NCLEX 311. People are saying it's like actual. Parang in reflection po talaga, sir, ng QUICKFIX YouTube and 311 yung questions that I got. So happy I got through the exam successfully. Thank you, sir, ng marami. Blank came out. I was like, Sir Ray, know the topics that would come out. I'm glad I'm a Gapuz baby. So what they're saying is, it is pato. Okay? And it's legit. Okay? Some people are saying NCLEX 311 is the best. Halos same na same po siya sa mga pagkakakonstruct sa mga na-encounter ko pong mga standalone questions. Sincerely speaking, if it were not for NCLEX 311, I would not have passed. I went through it the last 4 days of the exam. The book is amazing. Keep up the good thing of helping us nurses. Thank you so very, very much. And that's the reason why the world's oldest NCLEX RN passer, she's 66 and she turned 67 this May. Okay? Okay, and that's Mommy Flor Villarreal from Ago Foundation College in Naga City, who passed the test. That's December 2, 2024. I know you can do it. Okay, so let's use what we just discussed to answer a case. And this is case number 41. A 35-year-old pregnant female with a history of recurrent urinary tract infection and diabetes mellitus presents to the clinic with high fever, dull, constant flank pain. That should give you the clue. It's a flank pain and dysuria. Now, there's something here that I'd like you to focus on. The client is pregnant, but the pain is not in the lower abdomen. So we said a while back that if it's preterm labor, the pain usually begins from the lower abdomen. Here, the pain is found on the flank, lower back. So think either pyelonephritis or renal colic. And then the client had history of recurrent urinary tract infection and diabetes mellitus. These are risk factors associated with pyelonephritis. Therefore, the nurse should anticipate interventions related to, is it 1, preterm labor, 2, renal colic, 3, pyelonephritis, and 4, cystitis. Remember, the pain in cystitis is like in preterm labor, it's in the lower abdominal part. So we eliminate 1 and 4. We're left with renal colic and pyelonephritis. Remember, renal colic is associated with renal stones, and there was never a mention of any of the risk factors for renal stone, but there's a mention of the frequent or recurrent urinary tract infections and diabetes mellitus, which are risk factors of pyelonephritis. Therefore, the nurse should anticipate interventions related to pyelonephritis. I hope our discussion in this case study helps. And may I invite you to visit our simulation room, the only simulator in the world for the next generation NCLEX. May I invite you to our world-class facilities here at the Ray Gapuz Building, United Nations Avenue, Manila, Philippines, where we have state-of-the-art, soundproof, fully air-conditioned and comfortable classrooms, of course, and we are proud with our very clean restrooms and comfort rooms and our student lounges, okay? Those of you who have yet to subscribe, we are now more than 27,000 in our YouTube channel. Please do subscribe to NCLEX Ray Gapuz. And we have a promo. Get a free review from us if you process your NCLEX RN application with ITAPS Gapuz. For those who are taking the November nurse licensure exam, we have a low down payment promo of $999. Join our 316 top-notchers in the past, including 8 #1 placers. And if you process your application with us, you'll get a free review. Just call ITAPS at 0955-658-5991. We also have unlimited next-gen NCLEX comprehensive review that's priced at $8,800. So, once again, this is your mentor, your fact check buddy, Ray Gapuz, at your service. See you in our next video. Take care and have a great day ahead.